I'm Dr. Riley. I'm coming to you today from Balancewell Health Center, and we're located right down the road here in Fairlawn. And what our mission is to help people find solutions to their problems without the additional use of pharmaceutical medications and or surgeries. I'll say that one more time slowly. Our mission is to help people find solutions to their problems without the additional use of pharmaceutical medications and or surgeries. Now, I'm a board certified family medical doctor, and I want to tell you about how I got to that position in life, okay? I was also born right down the road here in Patterson. And I guess before I get started, I should probably reach out and tell you that I'm a mama's boy. So for all the good men in here who come to recognize that they're a mama's boy, I'm one of them, right? And I want to show you how she played in my life throughout my life. So at Balancewell Health Center, what we do is that we've integrated the services from a lot of different practitioners under one roof, and we take the best skills that they have and put them in the programs for people so they can reach their goals. So for example, we have medical doctors like myself, we have acupuncturists, we have chiropractors, physical therapists, occupational therapists, nutritionists, and we're even trying to do some mental health, not because we think everybody's crazy like Dr. Riley, right? But we know that people have a considerable amount of stress, whether it's work stress or home stress. So I'm gonna tell you about myself now. When I was a young guy, maybe, I guess about 9, 10, 11 years old, you see, I knew at that point in time that I wanted to reach out and touch people. I wanted to move them, I wanted to motivate them, I wanted to be able to interact with them in a certain kind of way. So at that point in time, see, I thought I was going to be a singer, all right? I got accepted into Newark Boys Symphony Chorus down in Newark, and I thought I was in heaven. I just knew that singing was going to be my thing, and I was just going to be a singer. But I can distinctly remember one summer camp session, right? We all had to get up and sing our solos. So little Dr. Riley, about 12 years old now, got up, stuck his chest out, sang his solo, right? Smiled, and happy. But I can distinctly remember that evening, my choir director coming up to me with a finger in the air, tapping me on my shoulder, saying, "Son, this is not for you." Sure, it's funny now, but like I said before, I was a mama's boy, so I called mom on the phone, and eventually she made everything okay, all right? So not being a singer any longer, I decided what I was really going to do this time, right? It's about the time that the slide rules came into my life, but I was going to be an artist. So I got accepted into Arts High down in Newark again, which was a magnet school for performing and graphic arts. And technically, I was pretty good. I really was, I was happy, I was technically good. And I can remember one more time, somewhere in my junior year, we had to draw facial compositions. Like I said, technically I was good. I could draw a face, put 2 eyes in it, a nose and a mouth. When I put up next to him, absolutely nothing like him, right? But so once again, when my professors came up to me, right, reached out, said, "Son, guess what? This is really not for you." Okay. So time goes on. It wasn't really until I got to college that I realized, and maybe some of you realize this too, that my skills were really in math and science. 2 plus 2, guess what, has always equaled 4, is not going to change on you, right? Math and science was my thing. And as you probably also know here, that for a young man, teenage years, math and science is not very sexy, cool. Nobody really wants to chase after you when you say, I know 2 plus 2 is 2, 4, right? So math and science was me. I go on to medical school, and it was really an interesting experience, but decided I wanted to do family medicine. And so went on to residency school, and in residency school residency training is where you are actually trained to be a physician. Medical school is more book knowledge, residency programs are more training. And so what I was actually trained to do, little did I know at the time, but I was actually trained to evaluate a person, come up with a diagnosis, and at the end of every interaction, I was supposed to take out my prescription pad, say, here, try this for 2 weeks. If it doesn't work, call me back, and we will find something else, okay? That was my training. I learned to do that, and I didn't know that was happening to me until later on in life. But also in residency program, we had a slightly derogatory term that we used for certain people who used to come in and aggravate us. Every profession has aggravating people. I'm sure your profession has aggravating people, and you have little derogatory inside joke names for these people. Am I right? Right. Yes. So anyway, our derogatory term was called bad people. Okay, bad people, because bad people were those people that came to see me. They're real nice people, but they would come in and you were supposed to refill their prescriptions that they poured out of a brown paper bag, which was usually 10 to 11 to 12 prescriptions, okay? And that's how they got the name of bag people. Well, my first practice was in South Georgia, and I did everything there from delivering babies to taking care of people in nursing homes. Loved it, very rural practice, hospital medicine, everything. But what I wasn't really proud of, as you see, is that when I first moved there, I had met individuals who were taking absolutely no medications at all. But by the time I left, I had created my own set of bad people, okay? Could take it back today if I knew how to, but I can't, so I moved on. So right about now, you should be asking yourself, well, Dr. Riley, what happened to you? Why was it that you were trained to write prescriptions, but now you've kind of given that part of your life up? What happened? Some people might already know, right? You see, mom happens, all right? One day, mom called me on the phone. I was still in South Georgia, and she told me she had a problem. I went home to see mom. Mom just turned 95 the other day, and I went home to see mom, right? And I said, Mom, I know what your problem is, right? Order out a prescription. I said, here, Mom, take this. Mm-hmm. I didn't say try it for 2 weeks, I just said take this. She kind of looked at me and called out to her husband. Her husband's name was George. She said, George, Roth's here. He's acting like a fool again, George. He wants me to take this medication for the rest of my life. So she refused to take it, and I had to find her something else, and I did. And at that point, that's what set up for me what I call now the conflict of the heart. You see, because now I'm treating my mom, my nieces, nephews, brothers, sisters, aunts, uncles one way. When your mom or your daughter or your cousin comes to see me, I'm treating them a completely different way. The conflict of the heart. And if anybody has ever had the conflict of the heart before, you know you can't stay there for very long. You have to make a move, you have to make a change. So I went back and studied anti-aging medicine, where my mind was then opened up to different ways of healing people, different ways of getting people to gain or maintain or progress on their journey of healthcare, which is really starting out whatever level you are, but actually moving to the next level. Just like an athlete. The athlete is never really satisfied with where they are. Our health should be the same way. We should never be satisfied where we are, always trying to improve our level of health. So went back, learned how to introduce different kinds of medical care into one system. Along the way, I met Dr. Kaner. Now, Dr. Kaner, of course, had been doing this for much longer than I have, and we took us about 15 years to put our programs together. We've been doing it now probably for like the past 5 years. And like I said, where our goal is now is that we don't have to always introduce pharmaceuticals into a patient care program. We can help them get to the next level of health.